Despite a growing emphasis placed on prevention, pressure injuries continue to be among the most common, preventable hospital-acquired conditions. And in the U.S., they've been rising. To prevent pressure injuries, a widely used standard of care is to turn high-risk patients at least every 2 hours, day and night. Adhering to these turn protocols is becoming even more of a challenge, given the latest international guideline for pressure injury prevention, which recommends every patient be prescribed an individualized turning protocol based on each patient's level of activity and ability to independently reposition. With limited time, resources, and conflicting priorities, it can be an ongoing challenge for healthcare providers to maintain adherence to multiple turning schedules, measure turn adequacy and efficacy, and document all turn events. In fact, studies have shown that despite their efforts, staff are typically only able to keep up with turning schedules less than 50% of the time. This inability to keep up comes at a cost. Patients with hospital-acquired pressure injuries spend an average of 9.5 days more in the hospital and experience a higher risk of readmission compared to those without pressure injuries. Inpatient dissatisfaction is linked to higher pressure injury rates, particularly regarding the levels of staff responsiveness and communication. When pressure injuries develop under hospital supervision, accountability and quality of care may be questioned, negatively impacting morale and teamwork. On average, each hospital-acquired pressure injury a patient suffers adds an incremental cost of over $21,000. With approximately 2.5 million hospital-acquired pressure injuries each year, this results in $10 billion per year in unreimbursed treatment expenditures to hospitals. While the financial impact of treating pressure injuries is great, the human impact is even greater. Most notably, hospital-acquired pressure injuries account for 60,000 patient deaths each year. Hospital staff are doing their best to keep track of patient turning schedules, but with multiple priorities stretching their capacity in a hectic healthcare environment, a simple reminder of when a patient turn is due can be an effective tool in preventing pressure injuries.